morning, everybody. My name is Barbara Gottlieb. I'm the Director for Environment and Health at Physicians for Social Responsibility. Thanks for joining us this morning. For any of you who aren't familiar with us, PSR is a national nonprofit organization. We're led by physicians and health professionals and dedicated to addressing the greatest threats to human health and survival, which we see as climate change and nuclear war. We address fracking as part of that threat of climate change. We're over 60 years old as an organization and are the co-recipients of the 1985 Nobel Peace Prize for our work on nuclear disarmament. We maintain a national office in Washington, D.C., and we have individual members across the country and more than 20 chapters in states all around the country. Today, we're pleased to present the key findings of our latest report, Fracking with Forever Chemicals in Pennsylvania. This report, which is the latest in a series, utilizes industry reports, industry information to identify where dangerous PFAS chemicals have been used in fracking operations in selected states. In our examination of Pennsylvania, we also identified an accompanying problem, the extremely extensive use by the oil and gas industry of so-called confidential business information, which serves as a mechanism to shield from view the identity of the chemicals they are using in drilling and or fracking. And of course, that as a result, Pennsylvanians may be exposed to. You'll hear today from three speakers. Our featured presenter today is Dusty Horwit. He's the lead author, along with myself as co-author, of our new report, Fracking for Forever Chemicals in Pennsylvania. Dusty has spent nearly 20 years researching and working to protect communities from the health and environmental impacts of oil and gas drilling and fracking, as well as other environmental risks. An attorney and a former reporter, he has written a chapter on fracking chemical disclosure for a textbook published by Elsevier and has been quoted in and has had his work featured in media outlets, including the New York Times, the Wall Street Journal, and NPR. Previously, he worked as a deputy press secretary on Capitol Hill and as a reporter at the City News Bureau of Chicago. Dusty is a member of the Virginia State Bar. You'll also be hearing comments from two issue experts from Pennsylvania PSR. Dr. Ned Katire will discuss the health effects of PFAS exposure. Dr. Katire is a Pittsburgh area pediatrician. He enjoyed 26 years in private practice before retiring from patient care in 2017. He remains a member of the American Academy of Pediatrics Council on Environmental Health and Climate Change and is the president of Physicians for Social Responsibility Pennsylvania. Dr. Katire is also the medical advisor for the Environment and Health Project, bringing attention to the health impacts of fracking and petrochemicals in the Marcellus Shale gas patch. Our third speaker is Tammy Murphy. Tammy is the advocacy director at Physicians for Social Responsibility Pennsylvania, where she focuses on environmental health with particular attention to the health impacts of the unconventional gas development industry. Tammy's background is in education, law, and social movements, and she will discuss approaches to policy reform that could help break through the oil and gas industry's wall of silence concerning the chemicals they inject into wells. A few quick housekeeping notes before we get started. We'll go through all three presentations and then turn to the question and answer period. The audience will be muted during the presentations. In our question and answer period, we'd like to give priority to any members of the news media. So if you are with the news media and have questions, please, when we start the Q&A, plan to go first, and we'll ask everybody else to kindly wait a few moments. And then when the media representatives have had their chance, we'll open the floor for everyone. If you'd like to ask a question in the Q&A period, please use the raise your hand function at the bottom of your screen or under reactions. You'll be unmuted to ask your question, and our thanks to Julia Morgan, who is PSR's web manager, for handling that function and all of our tech functions today. In acknowledgement that this webinar is designed to serve the media, we're going to keep it brief. We'll wrap by 11:50, if not before. So let's hear now from Dusty Horwit. Dusty, the floor is yours, and I think you're going to share your screen.
That's right. Thanks, Barb. Hold on just a moment. Okay. Can everyone see the shared screen? Okay, great. So thank you so much, Barb. Thanks everyone for joining. As Barb mentioned, I'm the lead author of the report, and this is one of a series of reports that PSR has been publishing about the use of PFAS in oil and gas operations. PFAS are otherwise known as forever chemicals. And this series of reports began with a digital pile of thousands of documents from the US EPA, showing the EPA's regulation under the Toxic Substances Control Act of the chemicals that chemical manufacturers had proposed for use in oil and gas wells. What we found is that in one of those records, EPA was being asked to approve for commercial use of 3 chemicals that EPA's own regulators thought could break down into a very toxic chemical similar to an infamous type of PFAS called PFOA. And from that discovery in these EPA documents, and the discovery that EPA in fact did approve the chemical for commercial use, and it did go into commercial use in some places, we decided to look to see if that particular chemical and this class of chemicals known as forever chemicals were being used in oil and gas wells. And in 2021, we did initially publish a report, which was the first time that anyone had publicized the use of these very dangerous and toxic chemicals in oil and gas wells. And we have been looking into this issue ever since. We were not able to find evidence that EPA, the chemical approved by EPA and that went into commercial use, had been used, but we have found evidence that other types of these chemicals have been used. So today we're going to talk about what we found when we looked for PFAS in oil and gas wells in Pennsylvania. Our goal with this report is to help residents of Pennsylvania and government officials understand both the limited scope of what we know about PFAS use in oil and gas operations in the state, and also the much larger scope of PFAS use that may be hidden from the public by the state's lax chemical disclosure rules. So let me get into our findings in our report. First, a little bit background on PFAS and why we're so concerned about the use of these chemicals in oil and gas operations. PFAS are known for having a number of attributes. Some of them are positive. They're very slippery. They can stand up to very high temperatures. And so they have been used all over the economy throughout the past several decades in many different applications. Unfortunately, they also have some negative attributes. They don't break down in the environment. That's a function of a chemical bond between carbon and fluorine atoms that is one of the strongest known to science. They are toxic at microscopic concentrations. The US EPA recently proposed to regulate 6 different types of PFAS in drinking water. And they set the maximum contaminant level for the PFAS I mentioned earlier, PFOA, at just 4 parts per trillion. That's so toxic that one measuring cup of PFOA at that level would be enough to contaminate 28 billion gallons of drinking water, which is more than 90 times what the city of Philadelphia treats for its residents every day. So these chemicals can be extraordinarily toxic. They also spread easily in water if they get into the environment, and they have been linked to multiple negative health impacts. And you can see some of them here. These are health impacts from the EPA and the Centers for Disease Control. They include increased cholesterol levels, low birth weight in babies, increased risk of kidney cancer, increased risk of high blood pressure for pregnant women, a condition called preeclampsia, decreased vaccine response, which is, of course, very concerning in the age of COVID, and then increased risk of testicular cancer. We're also concerned about the use in oil and gas wells of these chemicals because there are many different pathways through which people can be exposed to PFAS or other dangerous chemicals used in oil and gas operations. This is a diagram of an oil and gas well underground published by the U.S. Environmental Protection Agency. And you can see here there are 5 different pathways that the EPA shows where there can be leaks in the well. Wells are typically a combination of steel tubing called casing surrounded by a layer of cement. And so you can see that on this diagram. Here's the steel casing that runs down the well. And then on the sides of it, this gray is the cement. When oil and gas companies drill their wells, they bore down typically straight through the groundwater initially. Then they put that steel tubing in place. They pump the cement down the center of the steel tubing. It hits the bottom of the well here and then fills up alongside the casing or tubing and forms what they hope is going to be an impermeable seal to seal off the groundwater from the well. So the water can't get in, chemicals and other fluids can't get out. But what the EPA shows is there are many different ways where these wells can break down, whether you have breaks in the steel, breaks in the cement, gaps in the well where fluids can escape and get into the groundwater. There also are risks above ground. Oil and gas operations, especially in this day and age, where companies are drilling into so-called unconventional formations, where oil and gas are dispersed over wide volumes of rock underground, use enormous volumes of fluid for their hydraulic fracturing. Once that well is in place, companies will typically pump into the well millions of gallons of fluid, a mix of water, sand, and chemicals to fracture the underground formation. That fluid is injected at very high pressure. After that hydraulic fracturing is complete, they turn the pressure off and that water reverses course, or the fluid reverses course and comes back up out of the well. And these wells generate, therefore, millions of gallons of wastewater, a combination of the fracking fluid and the naturally occurring water that's in the formation that itself can contain contaminants. This is a picture here of an impoundment of fluids in Amwell Township in Washington County, Pennsylvania. This impoundment did have leaks that contaminated the surrounding groundwater or surface water. It was one of several impoundments that contaminated groundwater and soil, I'm sorry, and resulted in a more than $4 million fine that EPA assessed against the operator Range Resources in 2014. So you can have leaks and spills above ground, whether the chemicals being pumped into the well or the wastewater. That's another pathway of potential exposure to PFAS. And then I also want to mention potential air exposure at oil and gas wells. Oftentimes, some of the gas that comes out of the wells is flared off. There is a potential that PFAS could be emitted during that flaring process, and it could be deposited on surface water or soil, and people could be exposed to PFAS in that way. So what we did for this report to try to identify where PFAS has been used in Pennsylvania is we examined a database that the oil and gas industry, to which the oil and gas industry is required to disclose hydraulic fracturing chemicals used in unconventional gas wells in Pennsylvania. These are wells that are typically developed with high volume fracking, and they're often drilled horizontally, where the well is drilled down and then the drill bit is steered and the well is drilled out in a sort of L shape. For all of those type of unconventional gas wells, companies operating in Pennsylvania must disclose their hydraulic fracturing chemicals to this database called Frack Focus, run by a nonprofit called the Groundwater Protection Council, or a non-governmental organization. We looked at those records and we were able to determine that in 8 wells, and you'll see these in the red dots here in Western Pennsylvania. Oil and gas companies over the last decade injected a type of PFAS called PTFE, or otherwise known as Teflon. That was the only disclosed evidence of PFAS use in oil and gas and unconventional gas wells in the state over the past decade. However, what is very troubling, and the larger story, is that in more than 5,000 of these unconventional gas wells, we found that the companies injected trade secret chemicals. Now, under Pennsylvania law, despite this general rule that oil and gas companies have to disclose their hydraulic fracturing chemicals in unconventional gas wells, there is a major exception, which is that they are allowed to withhold from the public, but not from the Department of Environmental Protection, chemicals that are labeled as trade secrets. And they have done this, as I mentioned, in more than 5,000 wells over the past decade. In addition, we found that they withheld at least one chemical identity as a trade secret in more than 1,200, as they withheld chemical identities as a trade secret surfactant in more than 1,200 wells over the last decade. And these surfactants are possibly more concerning because one type of PFAS that we know has been at least proposed for use in, and it has been used in some cases for oil and gas operations, are fluorosurfactants. These include the very toxic chemicals PFOA that I mentioned, as well as PFOS, which is another very toxic type of PFAS. So we are concerned about these wells that were injected with trade secret chemicals. Those are represented by the blue dots, and you can see these clustered in southwestern Pennsylvania, as well as the gold dots, which were the wells injected with, the blue dots were injected with trade secret surfactants, and the gold dots were injected with trade secret chemicals, and they're clustered in the southwestern portion and the northeastern portion of the state. We show in the report, not just on the map, but through a table, in which counties these chemicals were injected, and you can see the incredible volume of trade secret chemical use. In total, when the companies disclosed some type of trade secret chemical going into the well, those chemicals comprised 160 million pounds of material. That's a lot of trade secret chemicals, which the public does not know what those chemicals are. When it comes to the trade secret surfactants, the companies injected almost 5 million pounds of those chemicals. This happened in almost 30 different counties in Pennsylvania in the case of trade secret chemicals generally, and more than 20 counties in the case of trade secret surfactants. Now, there is some evidence that these trade secret chemicals may be PFAS. We can't know exactly what they are. Only the companies that make the chemicals or use the chemicals and the DEP, which receives the identities of these trade secret chemicals, knows what they are. But there are several sources of information that suggest that PFAS have been used for decades in oil and gas operations. And so some of these chemicals could be PFAS. One source of evidence is a very recent paper published by the U.S. Geological Survey and the Pennsylvania Department of the Environment, which found that oil and gas wells are among the facilities that have been documented as potential sources of PFAS. And they cited several other sources, two of which we cite in our paper. The second one is this 2020 paper by Julianne Kluge and other authors, which found that PFAS have been used for oil and gas extraction or proposed for use in oil and gas extraction since 1956. A 2008 paper by two authors, Murphy and Hewitt, found that fluorosurfactants, a type of PFAS, have been used in oil and gas operations for 4 decades. That would go back to the 1960s. And then in Pennsylvania, in our own analysis of the Fracking chemical disclosure records, we found that 15 oil and gas companies operating in Pennsylvania had disclosed the use of PFAS in other states, but not in Pennsylvania, raising questions about whether perhaps some of those companies are using this class of chemicals in Pennsylvania on an undisclosed basis. I want to add that there are two other very important gaps in Pennsylvania law that could hide a much more extensive use of PFAS than has been reported. One is that companies are not required to disclose any of the chemicals they use in drilling, whether in unconventional gas wells or any other type of wells in Pennsylvania. And that's very important because, as I mentioned, when companies initially drill an oil and gas well, they bore straight down through the groundwater before they put any steel casing or cement into the well to separate the well from the groundwater. So if they are using chemicals in that process, and they often do, those chemicals are likely to get right into the groundwater. So it's very important that the public and regulators know what chemicals oil and gas companies are used in drilling, but in Pennsylvania, there is no requirement for disclosing those chemicals. And then the other important exemption is that chemical manufacturers are not required to disclose the chemicals being used in oil and gas wells in Pennsylvania. There is evidence that we include in the report that oftentimes the companies that drill and operate the oil and gas wells, including in Pennsylvania, don't know the chemicals that they're using because the chemical manufacturers are keeping that information from them. So if there's no requirement that the chemical manufacturers disclose the chemicals, these chemicals may not be reported at all, whether under trade secret protection or not. And we think that those exemptions need to be closed. Here are just a few examples of oil and gas wells and the disclosures that we found in Pennsylvania. I'll just point to this one, second from the bottom, in Washington County in 2015. This was a surfactant that was used. Its CAS number, which is the key method to identify chemicals. It's a chemical abstract service number. It is the most reliable way to identify chemicals because each chemical has only one CAS number. That was missing from the records. So it was a proprietary chemical or a trade secret. And you can see the mass of these surfactants that were injected, 35,000 pounds. That if that's a PFAS, that could be an enormous amount of that chemical. And then in this well in Tioga County in 2021, a proprietary or trade secret surfactant blend was injected. 23,000, almost 24,000 pounds were injected. I'm going to quickly just show you that you can find the exact location of these wells by zooming into an interactive map on our website. This well here, it was injected with PTFE or Teflon. It's right near the Ohio border in far western Pennsylvania. And then you can take the information here, this API number, which is a unique identifier for each well, and you can go to the Frac Focus website. You can plug that number here into their search field on a page called Find a Well right here. And then you'll get a couple of PDF disclosures that will come up. And if you click on this first one here, you will see the original hydraulic fracturing chemical disclosure record. You can see the API number right here. And then on the second page of this record, you'll see where the company disclosed using PTFE or Teflon with its CAS number. One of the other findings from our report is that waste from oil and gas wells is a very large problem, as I mentioned, because it can be that it means that the toxic chemicals that are used at a particular well site can be transported to other communities and could impact the environment or health in those communities. This is a map developed by Frac Tracker Alliance, which also developed the maps for our report. This was done for Environmental Health News, and it shows all of the locations here with yellow triangles where waste from those 8 wells in western Pennsylvania injected with PTFE was taken. So the waste, as you can see, traveled quite a bit. And if that waste had some of that PFAS in it, and particularly if that PTFE had other more toxic types of PFAS attached to it, which it can have, that could be a very serious environmental and health problem. One last example, this is from northeastern Pennsylvania, very close to New York. This line running through is the New York border. Here's an example of a well that was injected with trade secret surfactants. You can see that when you click on the well here, it pulls up this pop-up menu that shows more information about the well. And we hope that people can use that to see where wells near them are located that may have been injected with PFAS or trade secret chemicals that could be PFAS. Finally, we have a number of recommendations in the report, including halting the use of PFAS in oil and gas extraction and expanding public disclosure. PSR and a number of environmental organizations are recommending that the state of Pennsylvania follow a policy adopted in law last year by the state of Colorado, which bans the use of PFAS in oil and gas wells and significantly improves public disclosure by requiring public disclosure of all chemicals used in oil and gas wells, regardless of whether in fracking or drilling, and requires disclosure from chemical manufacturers. Those are among our multiple recommendations. And I'm going to stop now, and we'll be happy to take questions at the end of the webinar.
Thank you so much, Dusty. I just want to underline something I think Dusty indicated, that these maps and tables, including access to the interactive version of the map, it's all available in our report, and that report is available on the PSR website at psr.org. We'll hear next from Dr. Ned Katire about the potential health implications of exposure to PFAS chemicals. Dr. Katire?
Thank you, Barb. Thank you, Dusty. If anybody is surprised by what Dusty just reported, clearly you haven't been paying attention. Dusty's published several reports now over several states showing similar, very disturbing findings. I'm talking to you from Washington County, Pennsylvania, which is the most heavily fracked county in Pennsylvania. So as a physician, but also as a resident, I'm very concerned about this information. There are around 15,000 different synthetic chemicals that are recognized by the EPA as per and polyfluoroalkyl substances, or PFAS. You can see here the many products that contain PFAS chemicals. Their water repellent, grease repellent, and fire resistant properties make them highly useful for many industries, manufacturers, and consumers. PFAS chemicals are found in food wrappers and packaging, stain-resistant and fire-resistant clothing, furniture, and flooring, non-stick cookware like Teflon, paints, varnishes, and solvents, personal care products like shampoos, cosmetics, and dental floss, and cleaning products. But while they're valuable to industry and useful to consumers, PFAS chemicals are dangerous when they enter the environment, when they enter our air and water and soil that we all share, and eventually when they end up in us, causing a wide range of health harms. The number of communities in the US that are contaminated with PFAS continues to grow at an alarming rate. The latest data from the EPA shows 3,186 contaminated locations in 50 states, the District of Columbia, and 2 territories. It seems that wherever the EPA tests public and private water systems, PFAS shows up. Military sites around the country have been contaminated, as well as airports where firefighting foam was used. If you see areas that have no dots on this interactive map from the Environmental Working Group, it's most likely because the EPA hasn't tested that area yet. Humanity has put so much PFAS into the environment over the last several decades that it can be measured in rainwater all around the world at levels greatly exceeding US and international healthy water standards. Whether PFAS is flowing back from oil and gas wells, or spilled on the ground, or turning up in landfill leachate, or raining from the sky, it's easy to understand when researchers at the US Geological Survey estimated last summer that almost half of tap water in the United States is contaminated with at least one PFAS chemical. It's likely that PFAS chemicals are used at well sites to reduce friction during drilling and fracking operations. However, the biggest concern is what's in the flowback. A large percentage of what goes down the well as water, sand, and chemicals flows back up as solid waste and wastewater that needs to be disposed of. So in addition to all the heavy metals and radioactivity present in the flowback mud and brine, we now have to worry about PFAS or forever chemicals flowing back along with other toxic fracking chemicals. One of the most upsetting things about this whole affair is that the EPA reviewed these PFAS chemicals and precursors for their use in fracking, and they expressed significant concerns about the potential health impacts, and yet they allowed the companies to use them anyway. Clearly not a good day for the precautionary principle. PFAS chemicals persist in the environment for a very long time, and once they get into our bodies, typically by ingestion or inhalation, they persist in us for a very long time as well. These chemicals are readily absorbed from the lungs and the gastrointestinal tract, but they aren't metabolized or broken down. They stay in the blood, and much of it eventually ends up in the liver. PFAS is then excreted slowly over many years through the urine and feces. Practically everyone in the United States has measurable levels of PFAS in their bloodstream. There's now a growing body of peer-reviewed evidence showing just how toxic PFAS chemicals are. It's a major public health concern that academic researchers and federal and state governments have only recently started to address. A number of human and animal studies have been conducted showing adverse health outcomes associated with PFAS exposure. Some of the associations are very strong. For example, its effect of interfering with infant and fetal growth, and its distribution or its contribution in increasing the risk of kidney cancer in adults. Other studies provide more limited evidence associated with harm. But make no mistake, PFAS is a systemic toxicant. It can directly damage major organs like the liver. It's oncogenic and associated with the development of kidney cancer and also testicular cancer in men. And there's some evidence showing a link to breast cancer. It can act as an endocrine disrupting chemical at extremely low concentrations, causing hormone dysfunction and thyroid disease, increasing blood cholesterol levels, which can lead to coronary heart disease. And PFAS can have an adverse influence on fetal and infant growth and development. Studies have highlighted concerns of possible impacts on human reproduction and pregnancy, including a link to pregnancy-induced hypertension or preeclampsia. There is good evidence showing that PFAS chemicals interfere with childhood responses to vaccines. Because there are few federal regulations limiting their use in industrial processes and consumer products, PFAS has become ubiquitous in food, water, air, and in us. That's why discovering what is potentially a major new source of contamination in oil and gas fracking operations is so alarming, especially those of us living in Pennsylvania, especially those of us living in southwestern Pennsylvania. The National Academies of Science, Engineering, and Medicine advises physicians to order blood tests in people with a history of high PFAS exposures. PFAS water testing is also advisable in areas with known or suspected water contamination. Water filtration is highly recommended when PFAS levels in the water are high or are suspected of being high. In addition to blood testing, doctors are reminded to examine patients for organ damage by checking a lipid panel, basic blood tests that check liver function, kidney function, and thyroid function. Physical examinations are also important, checking regularly for testicular tumors in men, screening for breast cancer, and the importance of blood pressure monitoring during pregnancy. Pediatricians need to understand that PFAS chemicals cross the placenta during pregnancy and accumulate in breast milk, so infants can be exposed while breastfeeding. However, breastfeeding should not be discouraged because its benefits still outweigh the risks. And also using tap water to make infant formula could actually raise the risk. It's also recommended that children who may have been exposed to PFAS chemicals should be examined by their pediatricians and tested for PFAS. Pediatricians should keep in mind that PFAS is associated with decreased antibody response to vaccines, and also that PFAS chemicals act as endocrine disruptors, which can affect teenagers going through puberty and adolescence as much as it can affect fetuses and young infants. There are resources that can help doctors get blood testing ordered for their patients. There's a diagnosis code that can be used when ordering, but there's no guarantee that health insurance companies will cover the cost of the blood testing, which can total several $100s. There are published guidelines to help providers follow up on the results of abnormal blood tests. There is no therapeutic medicine or procedure available to reduce elevated levels of PFAS in the body. The key is to encourage PFAS exposure reduction if a source of PFAS is identified, and then wait for the body to slowly excrete it while monitoring the patient for signs of disease. So I hope you found this information helpful. Thanks for listening. There's my email at the bottom. If anybody would like a copy of the slides, I'm happy to share.
Thank you so much, Dr. Katayer. And we can actually send out the slides after the presentation when we send out the recording. Our third and final presenter will be Tammy Murphy. Tammy, it's all yours.
Hi, everyone. So I'm Tammy Murphy. I'm the Advocacy Director at Physicians for Social Responsibility, Pennsylvania. And I am honored to be asked to speak. So only when the public became aware of PFAS as an emerging, life-lasting, widespread contaminant did the Federal Environmental Protection Agency create stricter, yet still not enforceable, drinking water health advisory guidelines. These federal guidelines merely raised awareness and allowed for the collection of additional data. Surprisingly, ahead of the EPA, Pennsylvania created our own enforceable maximum contaminant levels for PFAS chemicals in drinking water for public drinking water systems through the Environmental Quality Board early this year after examining the risks to human health and conducting a statewide testing program. Now that we know of another risky source of PFAS, thanks to Dusty's research through PSR National, we in Pennsylvania need to adapt. We need to protect human health from exposure by restricting the use of PFAS in unconventional gas development industry, and not allow the industry to keep use of such health-threatening toxins as proprietary secrets. Despite the starkly different political atmosphere in Colorado's legislature, we can learn from Colorado's response to a similar report PSR National released about PFAS use in Colorado's oil and gas wells. 6 months prior to Pennsylvania establishing our maximum containment levels, Colorado's governor was already signing into law their House Bill 1348, prohibiting the use of PFAS in oil and gas wells and improving regulations on the disclosure of oil and gas chemicals. For organizing advocacy purposes here in Pennsylvania, it's worth noting that Colorado also had another version of this legislation, House Bill 1345, that separated the prohibition of the use of PFAS in oil and gas wells from the improvements to the regulations on the disclosure of oil and gas chemicals. Also noteworthy for organizing advocacy purposes here in Pennsylvania, advocates in Colorado, including PSR's Colorado chapter, are currently working towards improving the implementation of House Bill 1348 through their Energy and Carbon Management Commission, ECMC. They are asking that the ECMC randomly test flowback in wells, as Dr. Katayer mentioned, to see if the chemicals found are consistent with those that the industry operators have disclosed, or if PFAS is identified. The steps Colorado has taken can offer us a template to customize to suit the environmental landscape in Pennsylvania. We can build upon the Environmental Quality Board's move to create enforceable maximum containment levels for PFAS in drinking water ahead of the federal standards. This process is a prime example of how states can enact laws that supersede federal law. We do not have to and really must not accept the bare minimum of federal guidelines or federal regulations as the threshold by which we protect ourselves. In the case of PFAS in drinking water, the Environmental Quality Board did more than the federal government to protect drinking water by examining the risks to human health, conducting a statewide testing program, and talking to those impacted by the change in rules. We can and must use the results of the examination of risks to human health and the testing program to call for an end to the use of PFAS in the unconventional gas development industry, and to call for an end to the use of hiding health-threatening toxicity under the mask of proprietary protection. It might seem daunting, yet we should remember that despite the industry's best efforts, the gag order for healthcare providers naming chemicals that they thought were impacting their patients in Act 13 was eventually and rightfully found unconstitutional. We should look at the findings in today's report as an unacceptable risk to public health that must be exposed and eliminated. Public health must supersede profit-driven secrecy. In my opinion, the disclosure of the use of health-threatening chemicals should not only have always been mandatory, the use of health-threatening chemicals should be prohibited prior to use. I believe that the precautionary principle should be the logical law. If a company or an individual for that matter wants to use a chemical to create a product, it should be law that they prove that their chemical concoction is safe. If they cannot prove that basic safety measure, then they should have to go back to their profit-driven drawing board and start again. The way we do it here in the United States is to allow products to hit the market or our watershed, in the case of fracking, and respond only in a piecemeal fashion to health and safety concerns as we experience them, which makes us all sacrificial lambs. We can and must do better. Please be sure to share the letter to the Pennsylvania officials that you have been given in the link, and continue to follow us as we work on these issues. Thank you.
Thank you, Tammy. You know, your reminder that the gag order on health professionals was overturned is a strong reminder to us that passing positive policies really is possible. And the letter that Tammy was referencing is available to you in the chat. It's a letter sent by a number of Pennsylvania-based organizations to Governor Shapiro and other office holders calling for some of these reforms. We'll open up the floor now for questions. Again, if there are members of the news media who want to ask questions, please go first. You can use the raise your hand function at the bottom of your screen, or it might be where the three dots are located. Julia will unmute you to ask your question. After any media representatives have asked questions, we'll open the floor to our PSR audience. So Julia, can you let us know if we have any pending questions? While we're waiting for Julia to respond or for somebody to be unmuted, let me just mention one other thing in regard to the proposed legislation from that might happen in Pennsylvania based on what was passed in Colorado. It takes a very smart approach that reveals the dangerous chemicals that are used while also protecting some of the confidential business information. I think that's important to the industry. What it does is to require that the chemicals used be listed, but not necessarily in the order in which they occur or their predominance in the product that's being used. It's kind of akin to what's done on food labels, where the ingredients are listed, but not the recipe. And that's an approach that we think can be very positive. Do we have any questions on the floor? Julia, can you unmute whoever has raised their hand?
Yes. Hello, can you all hear me?
Yes.
Yes, this is Paul Van Osdale, WTAE in Pittsburgh. As you all surely know, there has been a case that has been working its way through the courts here involving the Letkanich family in Washington County, and accusations that there were PFAS chemicals used in the wells drilled on his property. I'm wondering if any of you can touch on some of the issues that have come up on that case and how they relate to some of the issues that you've been discussing here. As I understand it, the DEP has said in that case that there may have been PFAS chemicals used, but that came from the rivers And I'm just wondering, again, if you could talk about how that may relate to the larger picture you're telling here.
Yeah, I can start on that one. I've seen the DEP's report in that case, and uh, I I do recall seeing them say that the PFAS could have been in river water that was used by the company that fracked the well near the Latkanich home, or wells near the Latkanich home. That certainly is possible, considering the prevalence of PFAS in our world, as Ned demonstrated. Um, what is another shortcoming under Pennsylvania law is that the oil and gas companies are not required to disclose the contents of the water that they use for fracking. And so that is it could be a significant shortcoming if that water in fact does have PFAS already in it from whatever sources, whether other oil and gas operations, whether from manufacturing facilities or military bases where firefighting foam has been used that contains PFAS. The other element that jumped out from that DEP report was that they concluded that there was no evidence that the company, I believe it was Chevron, used PFAS in those wells. And it was a little unclear how they could be so sure, considering these longstanding gaps in the state's oil and gas chemical disclosure rules, including the fact that the companies do not have to disclose at all the chemicals they use in drilling and that precedes fracking, and that the chemical manufacturers are exempt from the disclosure standards and may not convey to the companies drilling or fracking the wells all of the chemicals that they're using.
Thank you for that response.
Paul, if I could just add on to that, it wouldn't be surprising, would it, if the property you mentioned was drilled and fracked with PFAS chemicals. In fact, I don't think anybody would be surprised if every unconventional oil and gas well in Pennsylvania has been drilled and fracked with PFAS chemicals. Wouldn't be surprising at all. The problems with disclosure, as Dusty mentioned, are pretty radical. It's a big problem in Pennsylvania. And then, they use water. Yes, sure. They use it from the rivers. They use recycled water, which only allows accumulation and increasing concentrations of these toxic chemicals to be used and used and used again. So this is a major problem. Nobody should be surprised. It's completely plausible that since 2012, PFAS has been used in every oil and gas well in Pennsylvania.
Yeah, I mean, to say that the chemicals can be found elsewhere doesn't do anything to dispute the fact that the company may have used them on his property. And there are records of what they've used. The company holds records, and the government should be demanding to see them rather than disputing it and blaming some fact that it could be also elsewhere.
I believe we have one or two additional questions on the floor. Let's see if we can take at least one of them in our remaining minutes. Julia, do we have more? Someone else to unmute?
Hello, can you hear me?
Yes.
Oh, okay. My name is Wayne Wells. I'm calling from Cameron, New York. I've been fighting sewage sludge on farmland for 37 years, and I have two comments. One is that I think we have to go back to the source of these chemicals, hold the manufacturers responsible, and the proof, the criteria we should hold them to is, I think, unreasonable to say that they can prove that a chemical is not toxic, but they can prove that the chemical that they produce could be broken down. So we know that if something does show up, and the reason I say that is because we had two professors emeritus from Cornell University, Dr. Donald Lisk, he's dead now, and Dr. Murray McBride, both said since 1981 that the unknowns in sewage sludge are one of the basic reasons why we should never apply it to farmland. I also know that we are receiving in New York flowback from Ohio and Pennsylvania wells. These go into landfills, and the landfills are dumping into the river. And to give you one example, Elmira in New York gets 60% of its drinking water from the Chemung River. So that's all I have to add.
Well, thank you very much, Mr. Wells, for those observations. I'm afraid we are out of time. This completes our program today. On behalf of Physicians for Social Responsibility, thank you for joining us. Be well. Take care.